Welcome to Oasis E Changes Part 2. This is Michelle with thehomehealthnurse.com. Today we will discuss changes made to the administrative information section, where they added A1110 for language and A1250 for transportation. For question A1110 for language, use section A in boxes provided to include preferred language. Use section B to indicate whether or not the interpreter is needed to communicate with doctors or healthcare staff. Guidance describes item rationale to be related to language barriers leading to social isolation, depression, and safety issues. Language barriers can also interfere with accurate assessments. For section A, please include the appropriate language in the boxes indicated. Also, a dash can be used if the appropriate preferred language cannot be identified. And American Sign Language can also be a preferred language in this section. For section B, do you need or want an interpreter to communicate with a doctor or healthcare staff? The box is listed to the left for you to enter the code 0 for no, 1 for yes, and 9 unable to determine. You can determine this question by healthcare proxy if that is available. And if no one is available to help answer this question for the patient, if they are unavailable to do so, then you can always put a 9. A dash is not an appropriate response for part B of this question. For question A1250 transportation, guidance describes the intent of this question as a need for understanding patient transportation needs. This can help organizations assess barriers to care and facilitate connections with available community resources. In this answer option, you can check all that apply. So if the patient is having issues with transportation to medical appointments, you can select A. If they're also having problems with non-medical meetings, appointments, work, etc., you can also check B. If the patient is not having difficulty, you would mark C. If the patient is unable to respond, you can mark X. If the patient declines to respond, you are not able to use any information on record or a healthcare proxy information. You would have to mark this as Y, patient declines to respond. If a healthcare proxy is available to respond, but the patient is unable to respond, then you would answer whatever the answer was from the healthcare proxy at this time.